viewers, you are welcome to another episode of Youth Empowerment Series. Today, I have a beautiful doctor joining us for our discussion. I have Dr. Eriadua Ahima Nunu. She is a public health physician specialist and the head of Douala Medical Center. Dr. Nunu, you are welcome.
Thank you.
Dr. Nunu, you look stunning as always.
Oh, I'm following your footsteps, so since you're my mentor, I have to follow your footsteps.
Okay, so our topic for discussions today is hepatitis B infection. We are discussing hepatitis B infection today because 28th July is World Hepatitis B Day. As we all know, WHO has a lot of World Health related days in the year. They have mapped up 28th July as a day for educating the public on hepatitis B infection. So that's why we are here today, because this channel is also dedicated to educating the youth and the general public on health-related issues. So if we don't bite in this important discussion and education, it will be an error. So we are here to also contribute our quota to the discussion. So Dr. Nunu, 28th July is World Hepatitis B Day. What is hepatitis B infection?
Okay, thank you once again for inviting me to your Youth Empowerment Series program. It's an honor to be here. I know you could have chosen anybody, but to select me, I feel very, very special.
You are, and I look forward to having more of our education programs with you. I hope.
Certainly, no problem at all.
Thank you.
So hello to everybody that's tuned in today. And when we say hepatitis B infection, basically hepatitis is an inflammation of the liver as a result of injury to the liver cells. It can be as a result of viruses, bacteria, toxins, alcohol abuse, etc. But in this case, where we're talking about the disease or the infection itself, it's being caused by the hepatitis B virus. So that's what causes this infection or this disease that causes a lot of inflammation in the liver.
Great. So this kind of hepatitis we are talking about is the one that is caused by the virus hepatitis B.
Yes,
so that's what we'll be sticking to today during our discussion. Right. So can you tell us how one can get infected with the hepatitis B virus?
Okay, so there are quite a number of routes in which a person can be affected with the hepatitis B virus. The most common one is the unprotected sex route, where people have sex without wearing any condom or no barrier method. So there's exposure to the body fluids of their partner. It can either be heterosexual, that is male and female, or homosexual, that is man to man. Okay. So that's the most common routes that we can get the hepatitis B infection. You can also get it through it's really like those who tend to abuse drugs a lot, okay. The intravenous drug users that inject the heroin and all that, they share their needles sometimes without actually sterilizing them. So they can also pass it on. It can also be passed on from an infected mother to a child. So during the pregnancy or even through delivery as well, I was through the delivery because of the blood contact and all that. So those are a few ways in which we can get hepatitis B virus infection. So usually it's through sexual contact, through mother to child. It can be sharing of razor blades, sharing anything that is sharp, okay, with somebody. Even if you go to the barbering salon, what they used to cut your hair, if they're going to use the same thing for the same person, okay, you also have a higher chance of getting the infection. So those are the most common routes. Sometimes you can get it when children play together and then maybe the person has a scratch and then, but not too common. You can also get it through blood transfusion and the blood is not screened for hepatitis B or other viruses or other infections. And let's say the donor is a hepatitis B positive donor, probably has the infection in the blood. Once that blood is donated to you and it enters your bloodstream, you can also have the infection. Okay, so I mean these days, we do the routine checks to be sure that they're not getting contaminated blood, but anything can happen. So those are the main ways of getting the infection.
I also want to add body piercing, tattoo. You see, these are
Yes,
also
yes,
things that have come up, and the youth
yeah.
seems to be fascinated by them.
That's
When
true.
that
That's true.
yes, their bodies without
Yeah.
being sure of the sterilization
The stools that I use, yeah,
process.
they can be
So
contaminated, yeah.
exactly. Basically, I think most of the routes that would let people get HIV infection are the same
Yes,
routes that can also let
yes,
people get hepatitis B infection.
yes,
It
yes.
looks like a lot of people have more knowledge on HIV infection
That's
than
true.
hepatitis B. So
That's
the
true.
knowledge that people have in HIV, the causes, especially those same causes through that will give somebody HIV can also give someone
Yeah,
hepatitis B. So
exactly.
when they have that in mind, I think that makes it easy to think about the
Yes, yes,
causes.
yes, yes,
Yeah.
yes. That's true. That's
And
true.
talking about maternal to child transmission. So usually when a mother is infected with hepatitis B, to prevent the child from getting infected at birth, we all know that they would inject the child. The child will receive the immunoglobulin, hepatitis B
Yeah,
immunoglobulin at birth to prevent
yes.
the infection. That should be given within 12 hours of birth, ideally. And that will tend to mop up the virus in case they are exposed to the
Mm-hmm.
hepatitis B virus. And also, but after that, they will take the regular
Yeah,
vaccination that
yeah,
every child would take. So
yes,
that
that's
just
true.
that should chip that in. And so it's important for every mother to go for antenatal because during
Yes.
antenatal, they will be screened for
Mm-hmm,
all
mm-hmm.
infections. And if a mother
Exactly.
is found to have the infection, she will be asked to buy the immunoglobulin and then at
Yes,
birth they
yes,
give it to the child to protect.
exactly, exactly.
Thank you. So let's look at the symptoms, signs and symptoms of
Okay.
hepatitis B infection.
Okay, so they're like flu-like in a way, so that general malaise, the headache, you may have some abdominal pain, you may have a fever. In some cases where the infection has gone a bit, it's not like no longer acute, it's more chronic, you may have some jaundice, that's the yellowing of the eyes and the skin and all that. You may have some liver enlargement, so your abdomen looks a bit distended or enlarged or something. So those are a few things to look out for. You may not even have any symptoms at all, and that is why screening is quite important because sometimes someone's walking around and doesn't even know they even have the virus within them. So the key here is screening and then also getting vaccinated once you're negative. But I think we'll come to that in the prevention.
That is, yes. So, and I also realized that sometimes the symptoms are even similar to symptoms of malaria.
Yes.
Sometimes because they will tend to
Yeah.
have, like I said, abdominal pain. Some people have joint pains, fever,
Yeah.
and they may think they have malaria
Very
or
non-specific
they
symptoms.
don't specific. Exactly. Very similar to malaria or enteric fever. That's typhoid. So the symptoms are
Yeah.
sometimes similar. So
Yeah.
people will be treating malaria, and sometimes it's probably the hepatitis B
Mm-hmm.
infection that they have acquired. So I think we should have it in mind as health professionals too. When people come with malaria-like symptoms and we screen them and malaria is negative, enteric fever, that's typhoid, is negative, we should probably think of screening for hepatitis B
Yes,
infection
yes.
too.
Yeah. That's good
Yeah,
advice.
we are all learning.
I know, right?
We just looked at the signs and symptoms. So let's go ahead to look at complications.
Okay.
What are some of the complications that hepatitis B infection can cause?
Okay, so you can have the chronic hepatitis B that can lead to liver cancer. And I mean, we all know what liver cancer can do. You wouldn't want to get to that stage of of the infection. You can also die as a result of untreated hepatitis B as well. If it's not treated, it's quite fatal. So those are the main complications. I don't know if you want to add any more to it, but I think those are the two that stood out for me.
Yeah.
The liver cancer and then the mortality rate. Yeah.
Yes, it can also, even before liver cancer, sometimes cirrhosis, the
Yes,
liver
cirrhosis
cirrhosis,
too. Yes, yes, yes. That's true. Can
and
damage the liver. Yeah.
cirrhosis is like a scarring of the liver. So when
Yes.
you talk of cirrhosis, scarring of the liver, for people to appreciate in the layman term.
Yes,
So
it's
it's
true.
scarring scarring of the liver, and this usually as a result of, so you need to infect the liver will get inflamed. So there will be inflammation of the liver, as you explained earlier on, swelling of the liver. And sometimes when it heals with scarring, and this leads to the liver cirrhosis, unfortunately. Then, as you said, the liver cancer. And yes, then liver failure, you see. So liver cancer, liver cirrhosis,
the liver can fail as well.
the liver will fail, and then mortality, unfortunately. So yeah, we'll get to prevention. So I was just going to say, how do we prevent all this? But we'll get there. So let's look at management. And when we talk of management, it includes investigation and treatment.
With the investigations, we'll do the hepatitis B profile and then the viral load as well. And then we do the liver function test, okay, so that we get to know the state of your liver. I also need to know that the infection is an acute one or chronic. Chronic means it has been there for more than 6 months. So that has to be done because that affects the treatment. Whether it's acute or chronic, we'll let the health professional know exactly how to manage you accordingly. But because liver also affects kidney and all that, I mean, you also have to do the renal function test. And usually a general body test, even the full blood count and all those things as well have to be part of it, the urinary and all that. So those are the investigations that usually are done. And even HIV as well, you can have some co-infection. People have both HIV and hepatitis B, together. They're on those drugs at the same time. So we also need to rule HIV out once we've diagnosed hepatitis B infection in a patient. So these are a few lab tests that we need to do to know how we are going to manage the patient accordingly, based on what we see, yeah.
I think usually we'll add even hepatitis C. We would screen, just like you said about the HIV. So we'll usually screen for HIV and hepatitis C too.
And even other STDs, you never know.
Exactly, because
do a full STD
they can all be gotten through the same route. So, like you said,
to be on the safe side.
So what put you at risk for this can also put you at risk for the other one. So we just for most of the STIs, yes. So usually we also add abdominal scan.
Ultrasound and all the CTs. Yes,
look at the state of the liver. Yeah, and then sometimes we even add alpha fetoproteins. This is a marker that will point to liver cancer being developed or on the way or something. Yeah, we'll leave it there. And when it comes to management, as we said, it's a viral infection, so they will be put on antiviral treatment alongside some liver support.
Exactly.
I also want to add here that when somebody is diagnosed with hepatitis B, the person has to stay away from alcohol and smoking. Dr. Nuno, alcohol and smoking, because these are things that also affect the liver.
The liver, that's true.
So if somebody
the alcohol,
the alcohol, exactly. So they will have to abstain from alcohol in order to help the liver fight the infection. And also, just I wanted to say avoid stress, but this time in age, sometimes you have no control over the stress. You have no control over the stress.
It's everywhere.
But you manage to, just take yourself off some unnecessary things so that your body can rest and fight the infection, and also eat well, balanced diet. So if somebody
you need a strong immune system.
Exactly, build your immune system to help fight the infection. So these are some of the things that people should look at doing when they are diagnosed with hepatitis B to help the medication and also the body to fight the infection. Right. So we are here with the prevention, public health. Public health. We are interested in prevention. We have to be big on the prevention here. So Dr. Nuno, and I'm sure everybody would want to know how they can prevent.
How to prevent. Well, the personal advice is screening. That's very, very important. You can't go away with that. I mean, until you screen yourself and your partner, you never know that you have it. You may not know your partner also has it, because at least once you know that you have it, then you can then seek further assistance. So at least the screening is quite important. Then the vaccination as well. Okay. Once you screen and are negative, then you can go ahead and get the vaccine. It's taken in 3 doses, so 0, 1 month, and then 6 months interval. And then you are done. Also, children also are on the program for vaccination as well, so they also get to be vaccinated. So it's not just the adults, children also get get vaccinated, sorry. And then you can also, really with the youth that are watching, please let's practice safe sex, okay? If you're not sure who you are going to have sex with or something, just carry a condom along. In case you don't know how you're going to you don't know if you're going to predict.
The best is to abstain.
The best is to abstain, though. You never know what happens.
Yes.
So at least if you have a condom in your bag, it can help you at that moment, yes. But abstinence is the best route.
Yes.
Just that, of course, we know that the world we live in, abstinence is a bit tricky, it's a bit difficult because people want to try things out, especially with the youth. They want to be experimenting and all that. So please experiment things safely, okay? Don't just rush to try something out. Always make sure you're using protection when you're having sex. It should be safe sex, okay? Let's try and avoid those intravenous drugs, the heroin and all those things. Avoid drugs at all. Say no to drug abuse. So you don't have to be sharing needles with people. With the blood transfusion, well, because now we are screening for blood, we hardly get those ones. With the pregnant women, I'd advise them that please go to antenatal care when you're pregnant. Don't stay at home, please. Because when you go to the hospital, we got to do all these checks. We get to see if you have HIV, do you have hepatitis B, do you have any syphilis or any disease or whatever. Whatever you have, we can save the child from getting that disease. But if you're a pregnant woman, you never attend antenatal care, you'll be with the infection throughout. Nobody knows you have that infection. You have the baby, pass on the infection right onto the child. So let's take antenatal care very seriously. The mothers out there, I don't think it's so expensive like that.
Not at all.
Yes,
Not at
yes, I think they should just consider all those things. And as usual, like we said, let's reduce our alcohol intake or even avoid alcohol if we can. Because alcohol clouds your judgment a lot and damages the liver as well. Yes, so the drinking, the smoking, all those things, let's do our best to just cut all those things out. So I think those are a few preventive things that come to mind. I don't know if I've left anything out you want to add on.
Not really. So usually the way I try to look at prevention is the causes. So I link
I know, right? So then you work backwards.
I link my prevention to the causes. So whatever will cause the infection, you try to do what? Prevent it.
Prevent it.
So all the things we talked about that could cause hepatitis B, we try to do the opposite to prevent it. So sharing of sharp objects, you mentioned this and all that. And I will still come back to my tattoo and body piercing. So the youth is either they don't tattoo and go slow on the body piercing and all that, or they should be sure of where they are getting
doing it, yes.
Things from.
They should be sterilizing the instruments that are being used.
Exactly. So with the prevention, I think what you mentioned covers everything. It covers everything. What I want to add is that Dr. Nunu, do you remember college? They told us that the fact that you are vaccinated doesn't mean you are immune.
Yes, I remember.
I remember Nana.
It's
Nana,
true.
Nana and whatever it is. Nana and greetings to you. Hey, Nana taught us vaccination. So the fact that you are vaccinated doesn't mean you are immune. You are immunized.
Yeah.
So people can receive their vaccination, but they won't be immunized.
Yes.
So after vaccination, maybe after some months, maybe 6 months onwards, one can go and check for the antibody titer levels of the hepatitis B.
Yes.
Sometimes people will go and check after the 3 doses and realize that their body didn't even mount out, or their body didn't produce the antibodies that's supposed to provide the protection. In that case, then they may need the booster doses. And also, well, as you rightly said, it is part of the childhood immunization schedule now. Hepatitis B vaccination is now part of the childhood immunization, because we have measles 2 vaccination coming in after the 9 months vaccination. Initially, we used to end the vaccination at 9 months, but now after that, measles too will come in. So after all that childhood vaccination, we expect the children to mount up immunity against hepatitis B. You know,
Wow.
in the past, they used to say the hepatitis B vaccine is given every 10 years.
Yeah, every
That's
time,
what
remember.
it used to be, yes.
So we
But
do the boosters from time to time, the
exactly
hospital
after that,
workers.
exactly. But with time, they also realize that some people have the antibodies. When they mount their antibodies, they have it for a long time. After vaccination, people should try and check
The
their
antibody titer to
levels to
see.
be sure whether they are protected.
Okay,
Whether they are protected.
okay,
Yes.
okay.
Thank you. So, Dr. Nunu, we have come to the end of our discussion. It's a short but straightforward discussion that has touched on important areas and what the public need to know about hepatitis B. I don't know whether you have any final words for our youth. This forum is for young people, though the general public, adults also benefit, but I would like you to give a message to our young people.
Okay, so my message to the young people out there, hepatitis B infection is real. You can easily get it irrespective of your age. So please, let's practice safe sex, abstain if you can, say no to drugs, the alcohol, heroin, etc. Please, let's stick to our books and all that, and then education is power, is key. If Dr. Dery and I didn't go to school, I don't think we would have been where we are today. So please, let's push all our energy into studying and getting somewhere, okay, rather than going off and veering off the wrong path, so that we can just be safe and sound. We need you alive.
That's true. It's a priceless advice. It's a priceless advice, and we appreciate it. Thank you for your time.
You're welcome. Thanks for having me too.
So, viewers, we have come to the end of today's episode of Youth Empowerment Series. We believe you have benefited from the education we have given. Share this video with all your contacts so that a lot of people will get to know about hepatitis B and know how to protect themselves from it. Subscribe to this channel if you have not yet subscribed, and turn on your notification bell when you subscribe so that when we post a video, you'll be notified to check on it. Thank you for staying with us, and see you soon. Bye-bye.